Just beneath the other important structure, this tubular structure is going inside the canal and just remove the culprit disc only. The spine was preserved and the only culprit disc was removed only, and there was only one suture. And the second day, what was the response of the patient? I am just showing. So now the canal is open. This is Carrison punch. Endoscopically, we are removing the ligamentum flavum, and we can see in the hole. Now this is the second. It's interesting because the quad equina syndrome is a life challenging condition, and now gradually we removed the ligamentum flavum and exposing the nerve roots, traversing nerve root and now gradually we can see this is the ligamentum flavum, almost we removed for our purpose, and this is the lateral recess. We are decompressing the lateral recess. Now we can see this is the medial side, traversing nerve root are exposed. Now this is, we can see it's very interesting, just beneath the traversing nerve root, this is the disc fragment. This is the endoscopic view of this. This is the beautiful view in which we can see clearly this is the disc fragment which is compressing the nerves, and we can see here the traversing nerve root is not pulsatile, and the next picture or the video in which after removing the fragment of the disc which was compressing the nerve, we will see it will pulsatile, and gradually this is right now it's not pulsatile. It's very interesting case. Last week we have done 2 quad equina syndrome back to back in the Mad Harbor, and fortunately the nerve root hook, it will come intactly. Now this is the disc fragment which will come. This is the disc fragment. You can say clearly it came pulled out intactly. This was the only culprit part of the disc which was compressing the nerve roots. This was taken out intactly. It's very beautiful step of this surgery, and it was done by only the 7 mm of the step. This is, we can say this is the intact part which is taken out endoscopically. And after that, you can see the nerve root definitely will pulsatile. Now this is the difference. Now we can say this is the pulsatile nerve root, this is S1 nerve root, which is compressed by just beneath this fragment, and this fragment we already taken out. Now this is the completely free S1. This was the whole procedure. The one suture was there after the procedure, and what was the patient's thoughts at the day 2? She was overwhelmed and she was recovered very well. Catheter was removed at the 7th of the day of the surgery. She are doing, and this is our whole team. Just after the day 2nd, she was celebrating, and she have wrote some words on the Google profile also. So this was the case of a quad equina syndrome, and we managed very well. So Mad Harbor is the now pioneer center or the hospital in the NCR, we can say, which is in which we are dealing with the minimal invasive endoscopic spine procedure, whether it is canal stenosis, whether it is a simple disc, whether it is facet joint arthropathy or discogenic pain or annular tear, any cancer pain, any kind of the osteoarthritis, any degenerative conditions. So this center is now became the most important and most advanced center for any kind of pain intervention or the spine surgeries, where which we dealing the all kind of the spine conditions. And with the blessings of our HM Bajaj sir, respected sir, now I want to call Bajaj sir. Without their support, we are not, we cannot So the Bajaj sir is a versatile personality, and he is a surgeon and a gardener, and final he is a author. He brings 40 years of the experience in the spine and orthopedic surgeries. He is a product of Manipal. He is a teacher of Manipal, and he worked in UK, Australia, Malaysia before coming to the Delhi. And since 9 years, for 9 years, he worked in the Indian Spine Injury Center. After that, since 2007, sir has working with the Max Hospital in the North India, and sir is head of the department of the spine and joint replacement in the Max, and most importantly with the Manohar